we are going to talk about nutrition in pregnancy. Now we notice that for a pregnant woman, there are key things we need to be very conscious of. We need to be conscious of the level of physical activity that she needs to have for so many reasons, in order to balance the energy, in order to derive a lot of health benefits. We are interested in the type of diet, the nutritional intake for that woman. We are interested on the weight of that woman. The weight because of the effects of obesity on the total health of the woman and of the child, the unborn child. We're also interested in what we call metabolic programming. The nutritional status in a woman that is pregnant has a lot to do with the health status of the fetus and the health status of the unborn baby when the baby is finally born later in life.
So how do you feel physically and emotionally?
Well, physically, I feel so strong. Emotionally, what? I'm just happy. I'm just happy I'm expecting baby as well. Most times when I feel unstrained, I'm a lover of soft drinks, so sometimes I just take Fanta and then maybe I rest.
Do you take energy drinks?
No.
So have you had any challenges like swelling, back pain, or indigestion?
Not at all.
Okay. So are you eating differently to prepare for labor and breastfeeding?
I take more of breaks, so that's all. I more of take fruits like banana, pineapple, apple, just fruits.
Actually, my first trimester was actually very tough because I always find myself vomiting anything I eat, anything that comes around, anything I taste. But now I'm no more feeling nauseous.
So if a woman has under or overnutrition while pregnant, the chances that the outcome of that pregnancy, which is the baby, will develop chronic diseases are very high. And this is why we need to look at all of them one by one. Now, if we come to nutrition, we'll be looking at what do these women need in various trimesters. What is the value of the calorie, the energy content that the woman requires daily? What type of protein and what quantity of protein does she need? What quantity of carbohydrate does she need? And what quantity and type of fats that she needs? Now, all of these four things constitute the macronutrients that she needs. We'll also, on a second segment, talk about the micronutrient requirement, which will include the type and quantity of vitamins and the type and quantity of minerals. So, pregnancy as it is, we have to be very careful and deeply involved in trying to define what is pregnancy and what the pregnant woman needs. Now, a pregnancy is not when the woman is pregnant. There are things we need at preconception state. And that is why when we are doing marriage counseling and all of that, we are interested in knowing the health status of the man, the health status of the woman, and then what will the woman really need preparing and planning for pregnancy. Preparation and planning for pregnancy is very important, and men must know this so that they will know how to tailor their care towards their wives. Because some of these requirements that we are going to mention, especially the micronutrients, will be needed in certain quantities at preconceptual state, because their role in the fetus will actually be needed in most cases in the first 3 to 4 weeks. Within the first 3 to 4 weeks, things like folates from food or folic acid as a supplement will be needed because of their effect in nervous system development. The nervous tissues are very key. The brain, the spinal cords, they are very key. The spinal cord that we see that is running from the neck region down to the coccyx is actually very important. So the moment the folic acid, for instance, is not there in the right quantity, the baby can develop what we call neural tube defects. So we are going to look at all of this now. When we talk about metabolic programming, we are looking at the effect of undernutrition on the various tissues of the fetus, the skeletal muscle, the brain tissues, the kidney, the pancreas, the liver, the bone. If all these organs are affected, the total effect when there is a second hit of this deficiency is that the baby will certainly develop non-communicable diseases. Things like cardiovascular diseases, things like diabetes, things like asthma, and of course, cancers of different types. Type 2 diabetes mellitus are more common. So that is what we are trying to prevent. We're also interested in making sure that other things that keep the woman healthy is there. We've mentioned about not allowing obesity to occur. But we also know that sedentary lives lead to obesity. Other lifestyles like overindulgence on sugary food and late eating and less physical activities are there. We do not preach against physical activity for pregnant mothers. Pregnant mothers must also know that physical activity is important to them. But the physical activity should be of moderate intensity. We don't want severely intense activity. Things like jumping. The other source of energy that's also very much needed in the system is fats. 30% of energy content, energy requirement of the body should come from fats. But the type of fat we take is very important. You know that omega-3 fatty acids, there's what we call omega-3 fatty acids. I'm not talking about supplements here. As much as possible, stay away from supplements. But let us go for the food sources of these. So, when we talk about fats, there are fatty substances we don't recommend. We recommend fats from oily fish. We recommend plant sources of fat like lime seeds. We recommend some other good sources that will ensure you don't have saturated fats. Saturated fats are not good, whether you are pregnant or you are not pregnant. So you try to reduce saturated fat as much as possible. Now, the fat requirement is needed because the fetal development, for instance, from omega-3 fatty acid is dependent on such important fatty acids.
Don't jump, please. I'm not calling you. When we say a pregnant woman should wear size, this kind of simple exercise we are looking at. Carry your husband by the hand, walk with him, stretch from your house to the main road. So when you come, because if you sit too long, you know what will happen. Because your blood circulation is not at this part, you know you are carrying extra weight. So it's going to stop blood from normally flowing normal. And when the blood is made to stand in one place for a long time, it can cause more problems. So when you move about, this muscle will make sure that your blood is moving well.